This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we're going to be discussing ketamine-assisted couples therapy with Dr. Chandra Khalifian. Dr. Khalifian is a clinical psychologist, researcher, educator, and Co-CEO of Enamory, a clinic and community focused on providing expansive relationship education and therapy, including psychedelic-assisted couple therapy. Now, before we get to Dr. Khalifian, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And your ever-present reminder that if you are a clinician and you'd like to learn more about psychedelics, we would love to have you join the Psychedelic Medicine Association. It is our mission to educate clinicians of all varieties on psychedelics so that you feel comfortable discussing them with your patients when they come asking with questions, because they will. If they're not already, they're going to come asking. So head on over to psychedelicmedicineassociation.org and join us and keep yourself up to date on the latest. Now, without further ado, thanks so much for joining us today, Chandra.
Thanks for having me. This is really exciting to talk about.
I'm very excited to have this chat. And also, as I was reading that little thing, I just thought I'd like to say thank you for being a member of the Psychedelic Medicine Association. It was lovely to have you join us and be one of the first people to participate on our community platform. Note to all Psychedelic Medicine Association members, hop on the community platform. It's a party. All right. Now, let's get started by discussing a little bit about your background and how you got into working with ketamine. Did you work with ketamine with individuals first, or have you always worked with ketamine with couples?
I had done some work with ketamine with individuals in another space that I work in. But I am a couples person by training. I did couples all through grad school and have always done couples in my career. And so it has always been a goal to bring psychedelics into couples work.
That's very exciting. I have never done it, but I think that's got to be a very special dynamic and special set of skills that you have to be a couples therapist. And so I'm interested that with that background and your background doing ketamine with individuals, what about what was coming out in the ketamine research made you think that it would be advantageous to bring it into the couples world?
Yeah. So I can talk a little bit about just kind of what ketamine is, and then also what we do in couple therapy. So then I can
Perfect.
kind of fit them
Yes.
together. So ketamine is a dissociative anesthetic. And so it brings you kind of into this space where you are observing your emotions and thoughts and patterns a little bit outside of yourself. So we often, when we're having big emotions, we kind of feel like we are our emotions. I am sadness, I am anger, or our thought patterns, right? I am worthless, I am unlovable. And it can be really, really hard to disentangle ourselves from those, which is why ketamine is so good with like depression and suicidality, because it can pull us out of those very rigid patterns. And so in couple therapy, the first thing that we are going to do with a couple when they come in is start to outline the dysfunctional pattern that they get stuck in. So all couples will have patterns that they kind of go to when they're in distress. Often couples will fight about like the laundry or the dishes, or it is never about the laundry or the dishes. It's about, I'm not feeling seen, I'm not feeling heard. And so we're going to outline that pattern. And then in couple therapy, we're going to try to find those vulnerabilities that are below the pattern. So those, I'm unlovable, I'm a burden. And that's really what we're going to be addressing in couple therapy. The couple's going to be learning how to validate each other and kind of hear each other in those vulnerable spaces so they can connect. So ketamine is great because in the same way with individuals, with couples, it's going to pull us out of that pattern so that we can then see the pattern and talk about the pattern from this observer perspective, rather than being stuck in the it's me versus you, we can kind of look at it together, and the couple can say like, there's that thing that we do when we feel distressed. And now we can work together on that thing, that we can see it with a little bit more distance.
Okay. And I'm hearkening back to, we did an episode recently with your co-CEO, I believe,
Yes.
if that is the official title, where we were discussing MDMA assisted couples therapy, and she was illustrating some of the reasons why that was effective. And I remember, as she was talking, the same as you were talking, I start picturing like the actual nuts and bolts of what this looks like. So when
Mhm.
you were talking about like we can separate ourselves and look at our patterns, is this each person of the couple doing it individually, or is this something that is happening as a dyad?
Yeah. So there's a few different models, and you may choose different models depending on kind of where the couple is, what they're coming in with. So you can do medicine sessions with um, both people or all people in the relationship together. During a ketamine medicine session, it's going to be about 3 hours. The medicine is going to last about an hour and a half, and then there will be some kind of coming to baseline, and you'll do integration with the relationship partners together. They are going to have headphones and an eye mask on during the medicine session. And for kind of the hour and a half of medicine, it's going to be largely internal. So everyone could be having kind of slightly different experiences. Different things could be coming up that they're working with. And then we'll kind of come together and integrate. Sometimes a relationship partner may kind of want to come out of the headphones and the eye mask and either talk to the therapist, or if they want to talk to their relationship partner, will kind of ask if it's a time that they can do that. And the partner can say, no, I'm totally doing my thing right now. I need to stay where I'm at. Or they can kind of talk and connect. Or sometimes when there's been like a lot of trauma with an individual or in the relationship, the idea of doing a medicine session together might feel overwhelming or may not be the best fit. And so they might do their medicine sessions kind of separately, have some space to talk with the therapist, and then still come back together for integration. So the couple will always be coming together for prep, integration, and then any couple therapy sessions that are happening between medicine sessions.
And that it's so interesting that you bring up the fact that they may want to speak with the other partner. And if that partner feels as though it's okay, that must be quite the emotionally open and vulnerable space to be having some of those discussions, no?
Yeah, for sure. Yeah, so ketamine works on our cognitions, so the stories in our mind, our emotions, and our behaviors. And with our emotions, you are going to be kind of in this more squishy, soft space. You're going to be more kind of heart open, more flexible. And so, yeah, it is a really special space for couples to connect in.
And on kind of the flip side, if something, I always feel that there's that very heart open, but on that same plane, if your heart is so open, it seems that something that might be a criticism could really uh, hurt, hit the other person a little bit more deeply. Does that kind of thing ever take place?
Um, so similar to MDMA, um, people are less likely to express criticisms in a hurtful way and less likely to receive constructive criticism and be defensive. So there
Oh.
may be things that are shared that are really challenging. Or like, when this thing happens, I feel a lot of pain, or something that in daily life could be interpreted as like, I'm defensive, well, you don't do that thing, right? Like, it's pretty rare that anything like that will happen in a medicine session. And if it does, there's a therapist there to kind of reinterpret and kind of get us back down into the emotional vulnerability. but they're talking about hard stuff. They're coming to therapy because they're having a hard time.
Yeah.
Yeah.
Yeah. As a therapist, as is that a challenge to navigate, especially because even though you're giving them both the same substance, I'm certain that they may react very differently to it. Somebody may be having a really deep journey and somebody might be having more superficial. How do you kind of navigate that as a therapist?
Yeah. Yeah, I mean, we really believe that everyone is getting the medicine journey that they need at whatever time. Um, and sometimes we have to reiterate that. Like sometimes there is some disappointment that, I didn't go to exactly the space that I was like wanting to go to. Um, and like that is just kind of more information to bring into like how does that show up in the relationship? Like is that a pattern that comes up for you frequently? Like it's all just information to work with. But we talk about that in preparation. There's never any like guarantee of where exactly you're going to go, but we're going to work with the content that's coming up.
That makes sense. And what does it look like in the whole journey, as in when you start with a couple who's come in and maybe their end desire is to do ketamine assisted couple therapy, or maybe they just want couple therapy, and regardless of whatever format that takes, can you tell me what it looks like with the kinds of preparation, how many sessions, what form of ketamine, that kind of thing?
Yeah. Yeah, so it may look very different depending on the couple and the therapist. So we actually, our paper that is coming out hopefully very soon, it will be the first couples and ketamine paper. It outlines a model that can be used like regardless of the couple therapy you typically use. So some evidence-based therapies are like emotion-focused couple therapy or integrated behavioral couple therapy. And so within kind of different models, you may have a couple coming in that just wants to come in for couple therapy, not necessarily coming in for ketamine therapy. And then you'll do kind of the assessment phase that you would typically do in any couple therapy, gather information, outline that pattern that we talked about. And then they may start couple therapy, and you may kind of hit a block where you're like, we are not able to get into this space that is deep and vulnerable. They're not able to do kind of empathic joining, which is where you really understand the person's emotional experience and kind of want to see the world through their eyes. Um, they may not be able to move into that place where they're able to see the pattern kind of from a distance. And so then you could talk about ketamine as a medicine that can help with some of these mechanisms of change that we're looking for. And if the couple decided that it would be a good fit for them, then you would do preparation. So you would kind of talk about what the medicine is, what they expect, what space you're doing it in. We do medicine with couples in their home. We could do it in an office. We could do it virtually. So kind of all the different options. And then kind of what are the intentions? So really kind of outlining that pattern again, talking about how ketamine can move us into these deeper spaces. And then they'll do a medicine session. And then that could be it. They could just do one medicine session, and then you do integration and move back into couple therapy from there. Um, you may have a few integration sessions and then do another medicine session. So you're going to outline a treatment plan with the couple, depending on what they're coming in with and what therapy you're doing.
And is the ketamine that you're using IM in these, or lozenges?
So we use lozenges if we are going into the couple's home and working with them, or if we're doing virtual. And we use IM if they're coming into a clinic where we work with an MD partner, and she would do the IM, and then we would do the therapy session with them.
Okay. And I'm glad that you brought up that there are different types of couple therapy that you have outlined in your paper, because as we get further on in, the psychedelic study world, I think it's interesting to see that we have bringing up more of like, okay, we know psilocybin plus cognitive behavioral therapy was great for smoking cessation, and
Mhm.
we also know that, MAPS is using more of a non-directive therapy. And so I think there's still kind of a big question mark of like, what types of therapy can we be combining with this? And so I'd love to hear your thoughts on that.
Totally. Yeah, I mean, Kayla and I are both trained in evidence-based therapies. We are researchers. We believe in data, and we we think that we should be using psychedelics with evidence-based therapies. Of course, also, like, we know that there is a huge history with psychedelics. It is all valuable. Just from our training background, we think that psychedelics are a tool that can be used to enhance treatments that we're doing. So we use psychedelics within evidence-based therapies.
I appreciate that. And you think that are there certain of the therapies that you've used that they seem to, like, say, jive well with better than
Mhm.
others?
Yeah. We tend to lean more toward like third wave cognitive behavioral therapies, so therapies that are more like mindfulness and acceptance based. A lot of what you're going to be learning in therapy um, is rather than like trying to directly change the cognitions, how can we kind of sit in spaces that feel scary and uncomfortable and kind of lean into it, and that's a lot of the work that you're going to be doing when you're using medicine. Like, there's going to be challenging thoughts that come up, there's going to be hurtful, scary emotions and memories, and it's really about how can I lean into this space. I know that the stories in my mind and my emotions are not going to kill me, but sometimes they feel like they're going to. And so, how can I be in these spaces and really lean into them and learn from them and not run away from myself?
That makes a lot of sense. Um, in in these sessions, what kinds of things have you seen couples maybe come to terms with, or things that have they like unraveled or revealed a pattern that perhaps you hadn't even been able to come uproot pre the medicine session?
Yeah. Yeah. I mean, couples can have kind of a very deep understanding of like things that have happened to them in their childhood or previous relationships, and kind of aha moments about themselves, about like, I completely understand why I'm reacting this way now, and let me kind of share this with you. And it can also work the other way. So I had one couple that the partner was like, I just felt this liquid compassion. I finally understood why she was engaging in these behaviors. And so everything kind of made sense, and I was able to talk about it in a different way. So it can happen both with people better understanding themselves and identifying some of these patterns, and really like through their partner being like, okay, I get it, and I'm willing to hear you differently.
Oh, that's really nice.
Yeah.
Is there ever a situation where you think that the patient may benefit from ketamine alone in preparation for the couple's work you plan to do with or without ketamine?
hmm Um, yeah, definitely. If someone's struggling with like depression that's interfering with them even engaging in couple therapy, or PTSD or suicide. So, yeah, they could definitely be doing individual work prior to couple therapy, or they could be doing their own individual work that is like specifically focused on individual issues. Whereas in couple therapy, that is a relational space where they can focus on the work that they're doing with their partner. Um, Definitely. There's also times where only one person is able to do medicine or wants to do medicine. So if a partner is pregnant or has um, any other reason, or just doesn't want to do medicine, like we've done work where one person is doing medicine sessions, but then they're still doing their integration together. They're doing couple therapy together. So if they're doing couple therapy, those pieces are always together with the relationship partner.
And speaking of being together, we know that after, one of the amazing things about ketamine like with all psychedelics, is that it reopens this critical learning period. Even with ketamine, it's, maybe 24, 48 hours. But
Yeah.
when you do ketamine by yourself, they say like, okay, now you can go be alone and et cetera for that period and fill yourself with good thoughts and do your integration. But if this is a situation where both in people in a pair are doing it, couple or more, and then they all live together and have to go back together during that integration, what kinds of things do you recommend for that they do in that critical learning window that's open?
Yeah. So ideally, we are going to do our integration session. If we're not, there'll be some kind of integration during the medicine session, but we will also come together again within that 24 to 72 hours to have kind of a dedicated integration session. Um, and then kind of a lot of the same things that you would recommend with individuals, like go for walks, be in nature, dance, cook, share positive memories, draw, like the things that like what gets you grounded and what can the two or more of you do together. Yeah.
Do you advise maybe of avoiding the triggers that, like, okay, maybe this is not the time we do the laundry, or whatever the thing is that they fight about. Like you said, it's never about the laundry, but if that's the trigger that always brings up the other things, do you suggest maybe just like have a chill couple of days where you can focus on your healing and try to avoid falling back into those patterns while we're still working on integration?
We are never going to tell them to avoid anything.
Okay. Okay.
And if they get into a potential moment where they could engage in their pattern, we are actually really hopeful that they've been doing the work that when that pattern starts or when there's that little spark, they can be like, wait a minute, this is the pattern. And
Nice.
we know how to do this differently, or at least we know what underlies this pattern. And maybe I can step away from this for a second and then come back with you and share like, hey, when I asked you to do the laundry and you walked out of the room, I felt that feeling of being really alone. And can we talk about that?
Gotcha. That makes total sense. Question about couple therapy. I don't think I asked Kayla, your partner, but is there, and this is not related to ketamine, but I guess could be, because the reason it came up to my mind is that a lot of people make major relationship decisions after having a psychedelic journey. And very often we think about that after like an ayahuasca journey, or maybe a big psilocybin journey.
Yeah.
Um, and sometimes that is that they decide to leave the relationship.
Mhm.
And I
Yeah.
was wondering how often that kind of thing um, comes up in a ketamine assisted session.
Yeah. I mean, not as much in couple therapy. I don't actually know if there's any data on individuals doing ketamine and that specific question. So I also don't know if there's like actual published data on psychedelics broadly in that question, but I have heard that like at trainings and presentations and with friends. So anecdotally, I am on board with what you're saying. Um,
Oh yeah. So let's be honest. So much of this podcast we have to rely on anecdotes because there's only so many things that have been researched, right?
yes. But yeah, I haven't seen it. I haven't seen it in my practice very much.
And I think even how you started to answer that question in couple therapy, you don't see it as much because if they're there, the other person is probably on board. They're working on things. It may be a situation where the one person is off alone at an ayahuasca retreat because their partner isn't willing to work on things.
Totally. Yeah. Yeah. So, what is the reason of even going on this life changing psychedelic journey on your own when you're in partnership? And I'm sure for the couples that talk about it before and are like, this is really important for this specific growth aspect of my life. And the other person's like, I totally support you. Like, go get them and I'll be here when you get back. Like, those couples are probably fine. It's probably the relationship partners that are like, I need to do this because I have no idea what I want or if this is the relationship that I want to be in. And then they have this experience that they realize they want to go a different direction in life. And that happens with or without psychedelics. That happens with major life shifts and journeys that don't involve psychedelics.
Yeah, absolutely. Something came up to my mind, speaking of anecdotes. And I just have to ask this because we were talking about, there's one thing to do psychedelic couple therapy, which is like we're in couple therapy and we're using psychedelics as a tool. And then
Yeah.
there's a separate issue of people who are coupled or paired or in whatever kind of arrangement, and they want to do psychedelics together for whatever reason, maybe
Mhm.
not at all part of couple therapy.
Yeah.
I have, let's say, at least anecdotally, run into maybe one or more couples where one of the partners is very protective.
Mm.
And like that's just the role they have in the relationship. And so when they go into these journeys, not even as part of a couple therapy, but they go to do a psychedelic journey with their partner, they can never really fully let go because their
Mm.
partner is still there and they're still playing that protector role. Is
Yeah.
that something you've ever seen come up?
Yeah, definitely. People will come to us for kind of like harm reduction integration. So a couple may have a psychedelic experience in the world outside of a therapeutic context and is processing some of those exact same things that come up. And then sometimes we also see that in therapy, which might be another reason why we choose to do a medicine session for one partner at a time. So if there is that dynamic of one person like really not being able to let go and staying in that protector role, that could show up if they do medicine together. And so we may have that protector do their medicine session and the other person kind of act as a chaperone and a support for them, kind of with the therapist. And so now this protector is in this space where there is a therapist and the person that they love actually really holding space for them and allowing for the protector to actually just like let go and know that they're safe and they don't have to be in that role.
I love that. And this brings up, just in case anybody did not hear the episode with Kayla that we did on MDMA assisted couple therapy, you just mentioned one instance where you might want to do the couple separately. Are there other instances where you think it's best to do them individually?
Um, It really, yeah, it depends on the pattern that they get stuck in. So if there's anything specific about the pattern that is going to interfere with them doing a medicine session together, but for the most part, we would have them do it together. Even if someone we do a consultation group with Journey Clinical, so any couples, any therapists that want to talk about couple therapy can come to that. And there was a question of like, what if someone gets like really emotionally dysregulated during their ketamine session or like starts yelling or so they are going to be wearing noise canceling headphones. The therapist will be there. I've never had the experience of someone being so disruptive that it like ruined the other or shifted the other person's experience. So um I wouldn't choose to do them separately because of something like that. It really would be specific to the pattern and like that protector role or something like that.
And could one of those patterns that would be best served individually be if the one person maybe has a history of trauma due to the other, and having them there might be an extra trigger or more destabilizing?
So if there is like severe intimate partner violence that like if that's what you're thinking of, they wouldn't actually be a fit for couple therapy. So we'll assess violence kind of in that beginning assessment phase that we talked about. And there's kind of a mild level where a couple definitely could engage in couple therapy. Things that kind of happen unplanned, slamming doors, maybe mean things are said, like those couples can do couple therapy and benefit. If there's like fear and intimidation or like severe levels of violence, broken bones, anything that is really kind of moving into that direction of like PTSD, it's not going to be a safe space to do couple therapy. We especially like if there's fear and intimidation, we don't know if what the couple's sharing with us in couple therapy is truth. We don't know if they feel safe to be honest. We could be working on totally wrong things because what's being brought into couple therapy may not be what's happening. And so with those couples, we would advise them to do individual work. So that person would work on trauma individually.
Okay, that makes a lot of sense. And you brought up your paper, which unfortunately is not out yet, so we can't talk. We can't link it in the show notes. But is there anything you can tell us about some preliminary results, or is it all top secret?
So it is a theoretical paper that outlines kind of this model that we're talking about. So no results in this paper, but we're hoping to test the model within our practice. Within Enamory, we will be kind of looking for some research funding so that we can test the model with our couples and get you that data.
Amazing. All you funders out there, take a listen. So speaking of, yes, where can people, because this is fascinating. By the way, thank you so much. Again, like I said, couples therapy. By the way, I think it's also called couple therapy. Because I think I'm even saying it wrong. So we'll
You
correct
can
that.
say it either way.
Okay.
Yeah.
But it's something I didn't know much about. So I really appreciate all the enlightening things that you and your partner Kayla have shared on the show. Where can people find out more about Enamory and all the work you're doing?
Mhm. Yeah, our website is enamory.org. And we also have an Instagram, which is at Enamory. So we post pretty much daily. We'll post little educational videos. We'll always post if we're doing workshops, all of our offerings with therapy. So everything is there. It's easy to find us.
Very cool. Well, I'm glad I found you in yoga class because I think I'm pretty sure that's where our paths or some other thing at the Ohm Garden. But I love having you guys here in San Diego.
Yeah.
And is there anything I've left out about ketamine-assisted couple therapy before I let you go? Random last question, but I realized like we covered a whole lot of ground, and so I'm like, I just want to make sure I was thorough.
I don't think so. This was wonderful.
All right. Oh, well, I appreciate you so much coming on and sharing your wisdom with us today.
Yeah, thank you for having me.
You're very welcome. For everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.